Now we are opening a session on quality of life and targeted therapy, and I would like to thank Professor Knecht for this opportunity, bringing a lot of people together and talk about different very important issues. And I think quality of life is one of those. Next slide, please. We have a distinguished panel. Next slide, please. And next slide. You know most names by face right now. Next slide. I talked to Professor Zelinsky, and I will give a short background before his lecture. Next slide, please. I think we need to have some basic definitions when we talk about quality of life. And this is a WH definition from 48 about health. Next slide, please. We also, next slide, have to define disability. And this is a bit more recent. Health and disability together, next slide, please, is the base for the quality of life assessment. And we must be aware it's not our opinion about the patient's quality of life. It's the patient's own appraisal that is the base for our measurements. Next slide, please. How do we measure quality of life? There are a lot of different questionnaires. I've listed, next slide, list them here. These from a thesis a few years ago. And as you see, there are several of them, and they measure different qualities in our life. Next, please. And specifically head and neck, there is also 7 different questionnaires addressing different aspects of disease and complications. Next slide, please. Next, please. I will just give you a series of dull slides to show you what our patients actually have to fill in. And the reason is that you get the answer depending on what you question. And as you see, there is a lot of question addressing dryness of the mouth. Next slide, please. You have question on several different. Usually there are 3 to 5 questions addressing the same issue. Next slide, please. And as you see, there are only 4 possibilities for choice, so you cannot put it just in the middle. You have to either be on the extreme or the left or the right of the center. Next slide, please. And there are questions about how was the last week. This is the basis for our quality of life measurements. Next slide, please. And what is the quality of life? This is data from a recent longitudinal study, and we can see here there are different aspects, but survivors, this is quality of life at diagnosis, and quality of life has a prognostic information. The poor quality of life, when you come, the poor is the outcome. Next slide. Next, please. Next. And here you can see this is a longitudinal follow-up for 5 years of a cohort, and we can see in survivors only there is a problem with dry mouth that is continuous over the time, and you have increasing problems with opening your mouth and eating. So that's the patient we face in our follow-up. Next slide, please. Next slide. And next slide. We have seen this already. There are different strategies on signal transduction, for example. Next slide. We have angiogenesis. We have, next slide, unique metabolic requirements. I think iodine 131 is a very good example of perfect targeted therapy. Next slide. And we have hypoxic cell center as some examples. Next slide. And you get a good information about the zeitgeist when you're looking at on the ads in a journal. Next slide. This is, next slide, next. This is what we find in the recent European Journal of Cancer. Next slide. And they depict a very bright future. Next slide. Next slide. This is from the last issue of Acta Oncologica. So targeted therapy is definitely a hot topic right now. Next slide. And we are going to discuss quality of life, and we should evaluate the evidence base. So I went into and looked at Medline. Next slide. I looked at squamous cell carcinoma, head neck neoplasm. There was 199 articles. Quality of life, different search strategies, 50,000. Targeted therapy, close to 20,000, and altogether 8. None of these 8 papers specifically addressed quality of life and targeted therapy. Next slide, please. We have some questions to consider after Professor Zielinski's talk, and they are, next slide, the most common types of toxicity. Next slide. Can we reduce chemotherapeutic dosage and thereby toxicity? Next slide. Next slide. How do we learn to handle? Next slide. The relationship with quality of life and survival. Next slide. What evidence level 1 to 8 has the data collection? I think that will be a very easy question to answer. Next slide. Next. And can we use the questionnaires we have today to evaluate side effects of new therapies? Next slide. Can we anticipate new late toxicities? Next slide. And the cost benefit of targeted therapy. Next slide. Next slide. Next slide, please. Next. Next. And my last question is, this is a slide I've used for 20 years. When new therapies come, there is, it will cure anything. I wouldn't use it on my dog. And somewhere in here between, I would ask, my last question to the panel is, where will we be in 10 years with targeted therapy?